It is important to have a kidney-friendly meal plan when you have chronic kidney disease (CKD). Watching what you eat and drink will help you stay healthier. The information in this video is for people who have kidney disease but are not on dialysis. Ask your doctor to help you find a dietitian. Medicare and many private insurance policies will help pay for appointments with dietitians. Check with your insurance company to see if your policy covers medical nutrition therapy (MNT). This information should be used as a basic guide. Everyone is different and everybody has different nutrition needs. Talk to a renal dietitian, someone who is an expert in diet and nutrition for people with kidney disease, to find a meal plan that works for you. Healthy diet basics with all meal plans, including the kidney-friendly diet. You need to track how much of certain nutrients you take in, such as protein, calories, fat, carbohydrates. To make sure you are getting the right amounts of these nutrients, you need to eat and drink the right portion sizes. All of the information you need to keep track of your intake is on the Nutrition Facts label. When you look at the nutrition facts, there are a few key areas that will give you the information you need. Protein. Having too little protein can cause your skin, hair and nails to be weak. But having too much protein can also be a problem. Protein is one of the building blocks of your body. Your body needs protein to grow, heal and stay healthy. To stay healthy and help you feel your best, you may need to adjust how much protein you eat. The amount of protein you should have depends on your body size, activity level and health concerns. Some doctors recommend that people with kidney disease limit protein or change their source of protein. This is because a diet very high in protein can make the kidneys work harder and may cause more damage. Ask your doctor or dietitian how much protein you should have and what the best sources of protein are for you. Lower protein foods: bread, fruits, vegetables, pasta and rice. Higher protein foods: red meat, eggs, fish. Calories: you may need to adjust how many calories you eat based on your weight goals. Some people will need to limit the calories they eat. Others may need to have more calories. Your body gets energy from the calories you eat and drink. Calories come from the protein, carbohydrates and fat in your diet. How many calories you need depends on your age, gender, body size and activity level. A doctor or dietitian can help you figure out how many calories you should have each day. Work with your dietitian to make a meal plan that helps you get the right amount of calories, and keep in touch for support. Fat: it gives you energy and helps you use some of the vitamins in your food. But too much fat can lead to weight gain and heart disease. Try to limit fat in your meal plan, and choose healthier fats when you can. Healthier fat or good fat is called unsaturated fat. Examples of unsaturated fat include olive oil, peanut oil, corn oil. Saturated fat, also known as bad fat, can raise your cholesterol level and raise your risk for heart disease. Examples of saturated fats include butter, lard, shortening, meats. Carbohydrates. Healthy sources of carbohydrates include fruits and vegetables. Unhealthy sources of carbohydrates include sugar, honey, hard candies, soft drinks and other sugary drinks. Some carbohydrates are high in potassium and phosphorus, which you may need to limit depending on your stage of kidney disease. What to eat. A kidney-friendly meal plan limits how much of certain minerals and fluid you eat and drink. This can help keep the waste and fluid from building up and causing problems. How strict your meal plan should be depends on your stage of kidney disease. In the early stages of kidney disease, you may have little or no limits on what you eat and drink. As your kidney disease gets worse, your doctor may recommend that you limit potassium, phosphorus, fluids. Potassium: it is a mineral found in almost all foods. Your body needs some potassium to make your muscles work, but too much potassium can be dangerous. When your kidneys are not working well, your potassium level may be too high or too low. Having too much or too little potassium can cause muscle cramps, problems with the way your heart beats and muscle weakness.
Eat this, lower potassium foods, apples, cranberries, grapes, pineapples and strawberries, cauliflower, onions, peppers, radishes, summer squash, lettuce, pita, tortillas and white breads, beef and chicken, white rice.
Phosphorus. It works with calcium and vitamin D to keep your bones healthy. Healthy kidneys keep the right amount of phosphorus in your body. When your kidneys are not working well, phosphorus can build up in your blood. Too much phosphorus in your blood can lead to weak bones that break easily. Eat this, lower phosphorus foods, Italian, French or sourdough bread, corn or rice cereals and cream of wheat, unsalted popcorn, some light-colored sodas and lemonade. Fluids. Depending on your stage of kidney disease and your treatment, your doctor may tell you to limit fluid. If your doctor tells you this, you will need to cut back on how much you drink. You may also need to cut back on some foods that contain a lot of water. Soups or foods that melt, like ice cream and gelatin, have a lot of water. Many fruits and vegetables are high in water, too. You need water to live, but when you have kidney disease, you may not need as much. This is because damaged kidneys do not get rid of extra fluid as well as they should. Too much fluid in your body can be dangerous. It can cause high blood pressure, swelling and heart failure. Extra fluid can also build up around your lungs and make it hard to breathe. If you do need to limit fluids, measure your fluids and drink from small cups to help you keep track of how much you've had to drink. Limit sodium to help cut down on thirst. At times, you may still feel thirsty. To help quench your thirst, you might try to chew gum, rinse your mouth, suck on a piece of ice, mints or hard candy. Remember to choose sugar-free candy if you have diabetes. Subscribe to our channel for more tips and hit the link in the description to get a powerful solution to chronic kidney disease at a discounted rate.